Let's talk about supplements and preventing COVID-19. I'm going to mention a couple of articles' titles, which is probably going to make you want to stick around. Then I'm going to show you how this fits into the whole scheme of improving your immune system, improving your overall health, reducing all sorts of diseases, specifically COVID-19. Here's article number 1. Essential sufficiency of zinc, omega-3 fats, vitamin D, and magnesium for prevention and treatment of COVID-19, diabetes, cardiovascular diseases, lung diseases, and cancer. Wow. August 2021 out of a journal called Biochemy. Okay? August 2021. That sounds like an interesting article. Don't you want to stick around for that? Here's article number 2. Zinc, vitamin D, and vitamin C. Perspectives for COVID-19 with a focus on physical tissue barrier integrity out of the journal Frontiers in Nutrition, December 7th of 2020. 2 cool articles. I'm going to summarize them in a minute, but let's see how they fit in our scheme, in our list of things that we can do to build our immune system. Now, keep in mind that we've developed this list on prior shows, and I've been talking about this for decades now, okay? So what do we do to strengthen our immune system and improve our overall health? Number 1 is, of course, nutrition. Number 2 is exercise. Number 3 is sleep. Number 4 is spine and chiropractic. Number 5 is stress. Number 6 is supplements. And number 7 is water. Here's the 7 things that we could do. And if we tackle these things, we're probably going to do pretty well. Of course, we're going to be dealing with a supplement issue right now, which also ties into nutrition, which is number 1. So it's number 1 and number 6 we're talking about here. So let's get into this. And by the way, great thanks to my colleague, Dr. Dan Murphy, who has made me aware of these articles that I'm sharing with you. Article number 1, we're going to talk about these supplements here. Zinc, omega-3s. Omega-3s are the fish oil, right? Fish oil. Those are the omega-3 fats, the good fats as we call them, omega-3s. Vitamin D, magnesium, and we're going to add vitamin C in here. So those are going to be the 5 things that we're going to be talking about. And remember, Dr. Fauci has said, and I mentioned this last year, Dr. Fauci takes 6,000 international units of vitamin D every day and 1,000 milligrams of vitamin C every day. He wouldn't say that, and he wouldn't do it unless he thought it was important for his body and important for his immune system. And he said, quote, something like, I'm paraphrasing a bit, he said, there's plenty of studies to indicate that doing these things are healthy things for your immune system. So article number 1, essential sufficiency of zinc, omega-3s, vitamin D, and magnesium for prevention and treatment. Those are the words of the article. I'm not saying that. Prevention and treatment of COVID-19, diabetes, cardiovascular disease, lung disease, and cancer. August 2021. Michael Story is your author. Listen now, listen, follow me, listen. 351 references. That's a lot. There's a lot of references in this article that came out in August of 2021. Key points. The essential nutrients zinc, omega-3s, vitamin D, and magnesium provide the ideal combination for prevention and treatment of COVID-19. Did you hear that on the news today? Was that on the headlines? Did you hear that on the headlines? I didn't. I think we should. I think we should all be on the mountaintops screaming this to everybody. I didn't hear that on the news today. Didn't hear that. Prevention of SARS-CoV-2 entry to host cells is what these nutrients do. Prevention and proliferation of SARS-CoV-2. Inhibition of excessive inflammation. A lot of you are now becoming, these are household words for you, inflammation and cytokine storm and tissue barrier integrity and so on and so forth. You're hearing a lot about these things. We're talking about these simple nutrients helping you in all of these facets. Improved control and regulation of the immune system. Inhibition of the cytokine storm. Reduction in the effects of acute respiratory distress syndrome, or ARDS. Reduction of non-communicable diseases, the ones I mentioned before, cardiovascular disease, cancer. Non-communicable diseases associated with COVID-19 are inherently more prevalent in the elderly than in the young, and the maintenance of sufficiency of zinc, omega-3s, vitamin D, and magnesium is essential for elderly to prevent the occurrence of non-communicable diseases such as diabetes, cardiovascular diseases, lung diseases, and cancer. Now remember, almost everybody that unfortunately dies of seasonal flu and flu like COVID-19 are people 80 and over and with comorbidities. These are your comorbidities, which means you already have a chronic problem beating up your body and causing problems with your immune system. So you become more susceptible, you become less able to fight off viruses with your innate and acquired immune system. So if you have these chronic diseases, you're not going to be able to do this. So if we work on preventing these chronic diseases, we're going to make everybody healthier, and then even if you get exposed to seasonal flu and viruses and COVID-19, whatever it might be, you're going to have a better chance of fighting it off. This is so great. This is about money now, about money and then health. The cost-benefit ratio would be huge as the cost of these nutrients and the testing of their levels would be very small compared to the cost savings of specialists and hospitalizations. Isn't that true? If somebody doesn't go into the hospital because they took some vitamin D and omega-3s and zinc and magnesium and later on vitamin C, pennies on the dollar, pennies. There's an immediate need for prophylaxis and treatment for COVID-19, and this is one of them. The essential sufficiency, so the appropriate amounts, of zinc, omega-3s, vitamin D for the prevention and treatment of cancer is understood. So if you'd like to increase your chances of not having cancer, get your omega-3s up, get your zinc up, get your vitamin D up, get your vitamin C up, get your magnesium up, do all these other healthy things that we're talking about. Very good. The four principal non-communicable diseases that are most prevalent worldwide are diabetes, cardiovascular disease, cancer, and lung diseases. The commonality of zinc, omega-3s, vitamin D, and magnesium in inhibiting inflammatory situations, as well as their ability to correct immune dysfunction together with the low cost and safety of these nutrients, make them ideal as front-line prevention measures and add-ons in treating COVID-19 and associated comorbidities, as well as the principal non-communicable diseases and non-COVID situations. Did you hear that on the news today? Was that in the headlines today? I didn't hear that. It's on this show here. These are the things that we should be talking about, right? Control of inflammation and the immune system are fundamentally dependent on sufficiency of the essential nutrients zinc, omega-3s, vitamin D, and magnesium. I've been talking about this for over 20 years. So is my colleague, Dr. Dan Murphy. So is everybody else that I hang around with. So are all the scientists that I know and the doctors that I know that are into natural prevention, health measures, and so forth. Now we're going to get into some specifics. So if you're sticking with me here, I'm now going to break down some of the stuff in this article that are going to go into specifics. Here's zinc now. Here's zinc. Zinc is a vital cofactor in more than 2,000 transcription factors and 300 enzymes in regulating cell differentiation, proliferation, and metabolism. In other words, it's important for cells. Zinc deficiency causes an imbalance of both the innate and adaptive immune systems. You've heard a lot about that. Your innate is the one that you're born with. The adaptive one is the one that learns to fight things over time. But sometimes we whack the immune system in an adverse way with chemicals like Roundup glyphosate and, I don't know, maybe other synthetic things that are coming from labs and stuff. So anyway, zinc modulates antiviral and antibacterial immunity. Interesting. Zinc deficiency lowers deficiency now, lack of zinc, lowers immune function and decreases resistance to invading pathogens. You don't have enough zinc, you're more susceptible to stuff you get exposed to. And by the way, there are trillions upon trillions upon trillions of viruses in the environment. You're never going to escape them. You're never going to go away from them. So I'm at the Woburn High School in Woburn, Massachusetts right now. There's probably more viruses in this school than there are stars in the universe. So we have to relate to viruses better, not to destroy them, not to run away from them. A number of comprehensive reviews of zinc and its involvement in aging, COVID-type viruses, and comorbidities have been presented. Again, there are 351 references with this one article. Zinc supplementation can effectively decrease the replication of a variety of viruses, including the replication of SARS-CoV. Did you hear that in the news today? Zinc has multiple functions in inhibiting viral entry to host cells. Zinc is essential for the normal physiologic process of insulin and is therefore directly associated with diabetes. Zinc deficiency is associated with atherosclerosis, hypertension, myocardial infarction, atrial fibrillation, and congestive heart failure. Low zinc, bad heart. Next, omega-3 essential fatty acids. Polyunsaturated fatty acids, omega-3s are the good guys, if you will. You want more omega-3s. Fish oil, think fish oil. Okay. If you're a vegan, you get it from algae. Omega-3 fish oil. Omega-3 polyunsaturated fatty acids have not received the attention they deserve in the prevention and treatment of COVID-19 and associated comorbidities, except for you'll hear it on this show like you have been for 20 years. Omega-3s are ideally suited for prevention and treatment of COVID-19. Prevention and treatment of COVID-19 with omega-3s. Prevention and treatment of COVID-19 with zinc. Obesity and diabetes, again. Prevention and treatment of obesity, diabetes, cardiovascular disease, chronic pulmonary diseases, and cancer, and improving immune function and anti-inflammatory effects in general aging from omega-3s. Do you know what your omega-6, omega-3 fat ratio is? Go listen to the show. I've done the show here thousands of times. You should know your ratio. You should know what it is. By the way, your information doctor, that's me. My ratio is good. I'm 2.2 to 1. 2.2 to 1. I'm doing good. I'm doing good. It's good. It's good because I've been doing these things. Omega-3s have an important role in regulating macrophage modulation and the production of cytokines and chemokines. You've heard about the cytokine storm, which is the overaction. It's the hyperacute activity of the immune system. It overreacts when it has the SARS-CoV-2 happening because you already have the comorbidities, because your immune system's already compromised. So you get an overactivity, which then leads to all these problems that lead us into the hospital and then so forth. Omega-3s inhibit inflammation by competing with omega-6, arachidonic acid synthesis, and pro-inflammatory leukotrienes and prostaglandins, a little bit more than we want to talk about now. Omega-3s have multiple inhibitory effects on viral entry into host cells. The viruses don't get in when your omega-3s are where they should be. The omega-6 omega-3 fat ratio has increased dramatically over the past 50 years and has contributed to the increased proportion of the population who are obese. Remember my prior shows that I've talked about that. 121 years ago, the average American was 1 to 1. If you're 3 to 1 or better, you're safe. If you're 15 to 1 or worse, you're at the risk of a chronic disease. The average American now is 25 to 1. I've seen as bad as 30 to 1 in a 9-year-old. My colleague, Dr. Dan Murphy, has seen 70 to 1 in an adult, a medical physician that was having all kinds of problems. They fixed that and the problems got better. It is recommended that omega-3 supplements be administered to those who are obese and at risk of contracting COVID-19 due to the immune modulatory properties of EPA and DHA, the fats, and omega-3s. Omega-3 polyunsaturated fatty acids reduce circulating levels of inflammatory chemokines, cytokines, and the pro-inflammatory metabolites derived from omega-6s. Omega-3s decrease inflammation. Higher consumption of omega-3s lowers the number of deaths related to cardiovascular disease. That's been well established. Okay, moving on to the next one. Vitamin D. Vitamin D, there's a strong link between seasonality of low vitamin D levels and the occurrence and prevalence of influenza and weather. And remember, unfortunately, some people die from seasonal flu, just like they die from COVID-19. So, and that happens more in the winter months, and we tend to be outside less, and we have less exposure, our vitamin D levels drop. More on that in a moment. Lockdowns implemented to minimize the spread of COVID-19 are therefore detrimental to vitamin D synthesis as people are prevented from going out from their homes and absorbing the sunshine, which has a cumulative effect in the winter months when COVID-19 is more prevalent. Lockdowns. There's an increased incidence of skin cancer and other cancers in countries with low levels of sunlight compared to those countries with higher levels of sunlight throughout the year, supporting the proposition that sunlight is beneficial for the synthesis of vitamin D and subsequent prevention of those cancers. Vitamin D has a powerful anti-inflammatory properties that plays an important role in controlling immune function in pulmonary infection. Vitamin D supplementation leads to an improved outcome for COVID patients. And vitamin D deficiency increases the risk and susceptibility for severe COVID-19 disease and mortality. So low vitamin D, you have increased risk of death from COVID-19. Interesting statement. Vitamin D deficiency was highly prevalent in patients with severe COVID-19, which correlated in turn with obesity, males, advanced age, population concentration in northern climates, immune dysfunction. So if you are already sick and you're obese and you live in northern countries and you have a deficiency in vitamin D, you have more risk of death from COVID-19. Deficiency of vitamin D increases the risk of contracting osteoporosis, cancer, diabetes, multiple sclerosis, hypertension, and inflammatory and immunological diseases. Get your vitamin D level checked and get it up. It's like a penny per day, maybe 2 pennies. Vitamin D impedes the entry and replication of SARS-CoV-2. Impedes the entry and replication of SARS-CoV-2, reduces the level of pro-inflammatory cytokines, more on that, right? Increases the level of anti-inflammatory cytokines and increases the production of natural antimicrobial peptides. The exposure of the aged to sunlight becomes severely limited. Older people tend to be indoors, right? Leading to diminished vitamin D levels with all the complications we just talked about. There's a strong correlation between vitamin D deficiency and obesity and vitamin D deficiency and cardiovascular disease. There's a strong association between vitamin D deficiency and the risk of heart failure. And don't forget, we'll talk about this a little bit later, vitamin D and strong bones, because it regulates calcium and so forth. Moving on to magnesium now. Magnesium. Magnesium is an essential element in the optimal biological functioning of the human body. If you want an optimum biological functioning human body, get your magnesium up, okay? Magnesium is essential for the activation of vitamin D. So now we're talking about synergistic nutrients here, which is why food is so important, but food is now not as nutrient dense as it used to be. So that's why we are supplementing. I suppose if we were getting the right supplements and outside enough, we wouldn't need this stuff, but here we are. Magnesium has anti-inflammatory and antioxidative effects, as well as providing vasodilation and neuroprotection. Magnesium suppresses NF-kappa B, expression of interleukin-6 and tumor necrosis factor alpha. I'm just spitting these things up, but you've kind of heard these things on the news a little bit. And those levels of C-reactive protein, an inflammatory marker. Magnesium regulates cardiovascular, digestive, neurological, and respiratory systems, contributing significantly to the maintenance of normal human health. The anti-inflammatory and antioxidative effects of magnesium provide cardiovascular protection. In prior shows, I've talked all about magnesium, done several shows on it. I've talked about how a couple patients, they had heart arrhythmias. We knocked them out with magnesium. Magnesium is a strong vasodilator, opening blood vessels, and bronchodilator, opening up your airway, and is useful in the treatment of asthma and chronic obstructive pulmonary disorder. Sounds important. Magnesium regulates the immune system, controls oxidative stress, inflammation, which is prevalent in early development of cancers. A little section on the immune system. The immune system provides 2 lines of defenses. Innate immunity, the first line of defense, you're born with that. Adaptive immunity is immunological memory to a specific antigen, which is the immune system learns over time. That's why you tend to get more colds and sniffles when you're younger, but the body gets exposed and gets re-exposed and gets re-exposed and learns and remembers and learns and remembers. Cytokine storm we've talked about, which is a problem with all types of inflammatory things and viruses and flus and COVID-19 flu and so on and so forth. The uncontrolled release of immune cells and excessive release of pro-inflammatory cytokines has been termed the cytokine storm. The key to counteracting this cytokine storm lies in counteracting excess inflammation. These supplements here, and the list I said earlier with nutrition and exercise and reducing stress and spine and chiropractic and supplements and water and so forth. These are all the activities that you do to reduce your systemic inflammation, improve your health, reduce the chance of having comorbidities, and then your ability for your immune system to fight off all viruses, including COVID-19. The inflammation can be largely addressed through maintenance of sufficiency of the essential nutrients zinc, omega-3 polyunsaturated fatty acids, vitamin D, and magnesium. There we are again. A section on aging, obesity, and non-communicable diseases. Deficiencies in zinc, omega-3s, vitamin D, and magnesium have been shown to provide significant risk factors for severe COVID-19 disease, as well as for pre-existing conditions such as aging, obesity, diabetes, cardiovascular disease, chronic respiratory diseases, and cancer. As the human body ages, there is a gradual decline in functioning of the innate and adaptive immune systems, which makes it even more important for us to be following these protocols to make sure you keep your body at peak performance all the time so you can fight off all viruses, including SARS-CoV-19, as this article is stating, as well as increasing the levels of pro-inflammatory cytokines. Again, these nutrients are going to regulate that. Deficiencies in one or more of the zinc, omega-3s, vitamin D, and magnesium will lead inevitably to a diminution of immune function as an increase in levels of inflammatory mediators goes up. Concluding this article, if you're sticking with me right now, zinc, omega-3s, vitamin D, and magnesium all act to suppress hyperinflammation and major disruptions of immune system that occur when there are significant invasion by viral or bacterial pathogens such as SARS-CoV-2 or non-communicable diseases such as diabetes, cardiovascular disease, chronic pulmonary disease. You've got to get these nutrients right. You've got to get that immune system right by doing all those protocols that I've talked about on this show and that we're adding to here. Zinc, omega-3s, vitamin D, magnesium have the ability to suppress excessive inflammation and dysregulation of the immune system, is the conclusion of this article. These nutrients are therefore essential in all aspects. When present in sufficiency, they are directed towards ensuring good health for humans at all times and for all ages. Isn't that an awesome conclusion to what we're talking about here in 2021 with SARS-CoV-2? Here's a note on vaccines in this article. Vaccines are rarely 100% in their prevention of transmission and their prevention of humans contracting the particular disease. Aren't we hearing more about that with the breakthrough stuff on the vaccinated? Vaccines face problems with mutation and diminution of their effectiveness, which we also are learning about right now. This stuff that we're talking about here are things you can do all the time to keep your immune system strong all the time, regardless of what's going on. Vaccines perform, this is also an important point about vaccines. Vaccines perform their function through the adaptive immune system, okay? While zinc, omega-3s, vitamin D, and magnesium affect both the innate and adaptive immune system, which begins to tell me that these nutrients are affecting cellular processes at the DNA level, DNA expression, the functions of what's going on in the nucleus of the cell. That's pretty impressive. Supplementation of the 4 nutrients in treatment of COVID-19 is therefore desirable, especially if the supplementation is beneficial in preventing or treating non-communicable diseases or reducing the adverse effect of aging. Is that like one of the most incredible articles you've ever read? It certainly is for me. I've read thousands and thousands of articles. I was really impressed with that. I have a few minutes left here, so if you're still with me, let's go to article number 2. This was zinc, vitamin D, and vitamin C on our list here. We're adding vitamin C now. Perspectives for COVID-19 with a focus on physical tissue barrier integrity. Frontiers in Nutrition. Frontiers in Nutrition is the journal, December 7th of 2020. This study cites 200 references, still pretty powerful in the references department. This review aims to provide a comprehensive overview in the roles of zinc and vitamin C and D in the immune response to viral infections, focusing on the synergistic action of these nutrients and the maintenance of physical tissue barriers such as the skin and mucous membranes, not allowing the stuff to get in the first place, getting into your cells. And if you prevent them from getting in there, you're doing better. The law of minimum says that these nutrients are in the organism in less quantity, or if they're deficient, they become the limiting factor of metabolic reactions, even if the other nutrients are present at adequate levels. So let's say all of your nutrients are really great, but you're low in vitamin D. Vitamin D is the weak link. The system is not at peak performance. You have to get all of these nutrients right. You have to get this whole list right. You have to get the prior list right on all the things that we need to be doing to, again, keep the body at peak performance. Key points from this article is my colleague, Dr. Dan Murphy, summarizes. Nutrition is a determinant factor for the maintenance of homeostasis and the health of different organs and physiological systems of an organism, including immune function. Nutrition, we've got to get that right. Inadequate nutrition is considered a contributing factor to the emergence of viral infection due to its contribution to weakness of the immune system, which increases the rate of infections and the risk of mortality and morbidity. If your nutrition is off, you have a higher risk of death and sickness from COVID-19, is what this article is saying right here. Viral infections increase the demand for several micronutrients such as vitamins A, B, C, D, zinc, and selenium. So when your immune system is activated and you're fighting off an infection, you need these micronutrients to assist in the fight. Zinc and vitamins C and D stand out for having immunomodulatory functions and for playing roles in preserving physical tissue barriers. Pretty cool stuff. Deficiency of one or more of these three elements compromises the immune system response, making an individual more vulnerable to viral infections due to a worse disease prognosis. These articles just keep getting better. Dietary supplementation of micronutrients with recognized role in immune function can optimize the modulation of the body's immune response, reducing the risk of infections. If you get these nutrients up, you're going to have a better chance of making it through just fine when you get exposed to stuff. Zinc and vitamin C and D, and as we said in the prior article, omega-3 essential fatty acids, omega-3s, and magnesium are the micronutrients where there is a robust evidence of their immunomodulating activities such that their deficiency, even if marginal, can compromise metabolism and consequently their action to the immune system. Remember that Dr. Fauci, as I said earlier, takes 6,000 international units of vitamin D per day and 1,000 milligrams of vitamin C per day. He does that because he knows it's strong for the immune system. Zinc is immunomodulatory and antiviral. Zinc deficiency affects approximately 1/3 of the population worldwide. It plays a role in the integrity of epithelial cellular barriers, skin barriers, which are essential for organism defense and prevention of pathogen entry, so it doesn't get into you in the first place. Increased intracellular concentrations of zinc reduces I'm going to start this one again, this is important. Increased intracellular concentration of zinc reduces the replication of RNA viruses. More zinc, decreased replication of RNA viruses. Did you hear that on the news today? Did you hear that on the news? During an infection, an organism can mobilize zinc reserves for priority functions, such as those associated with the immune system, leading to a decrease in zinc levels and possibly to the lack of zinc in other less essential functions, such as the maintenance of smell and taste. Senses often affected in patients with COVID-19. Interesting. Your zinc is down, you get loss of smell and taste because the zinc has been taken away to fight the infection, and zinc is important in those senses. Interesting of that correlation there. Most COVID-19 patients have gastrointestinal symptoms such as diarrhea, vomiting, abdominal pain, and gastrointestinal bleeding because of compromised intestinal mucosal barriers. One reason is a decrease in these micronutrients, so your skin is not as strong. Supplementation with zinc is effective in treatment of acute diarrhea. Zinc supplementation also reduces severity and duration of various cold symptoms such as fever, cough, sore throat, muscle pain, nasal congestion. There's a section on vitamin C. As an antioxidant, vitamin C prevents damage to biomolecules resulting from exposure to oxidants generated by normal metabolism and exposure to pollutants and toxins. Ascorbic acid plays a crucial role in the immune system, supporting the epithelial barrier. Vitamin C supports the immune system and reduces inflammation and organ injuries, decreases pathogen infection and virulence. Vitamin C. When people are under my care, I'm not telling you what to do. Please don't do this unless you talk to your doctor first. I get them on higher doses of vitamin C. I get them on more vitamin D. I get them on more omega-3s. I get them on magnesium. I get them under chiropractic care. I have them reducing stress and eating better and drinking more water, getting better rest, doing all these different things. Vitamin C modulates the cytokine storm, reducing high levels of the pro-inflammatory cytokine interleukin-6. And then on to vitamin D as we wrap up here. Vitamin D is actually a hormone. It acts on the regulation of more than 200 genes on different cell types. We're reminded that vitamin D has a direct connection onto DNA. It affects the DNA. Only about 10% of vitamin D comes from food. The rest is UV light from sun. We're not getting enough sun. You have a deficiency. That's why we have to supplement. In addition to class of effects on calcium homeostasis, vitamin D that is, and the maintenance of bone health, vitamin D plays an important role in immune system function. It acts as a powerful modulator of immune system. Given that vitamin D has receptors on all immune cells, vitamin D supplementation is associated with a lower risk of developing acute respiratory infections, and that positive effects of supplementation was even more pronounced in individuals with vitamin D insufficiency below 30. That's the way that we measure things here. If you're below 30, most of the patients that I get tested that are not already supplementing are below 30 at the beginning of intervention. Vitamin D, similar to zinc and vitamin C, plays an important role in formation and maintenance of epithelial-endothelial barriers, including lung tissue. The authors conclude that vitamin D deficiency plays an independent causal role in COVID-19 severity, and that prevention or therapeutic supplementation in populations at risk can be useful to prevent poor disease outcomes. About 2 pennies per day per person if we all took vitamin D. Did you hear that on the news? Given the COVID-19 pandemic, the WHO suggested social isolation here's another article saying this, for measure for restricting the spread of the virus. This measure may also contribute to the reduction in serum vitamin D levels because confinement and possible lack of exposure to the sun prevents the endogenous production of this hormone, reducing the body's capacity to fight COVID-19. If you stay shut in indoors, you get sicker. Vitamin D deficiency may be the most common variable among elderly individuals and patients with underlying diseases, populations more susceptible to complications and mortality by COVID-19, vitamin D deficiency. There's a synergistic action between zinc, vitamin C, vitamin D, and physical barriers. The outer and inner surfaces of an organism, such as the skin and mucous membranes, are the first line of defenses against pathogens, literally a physical barrier, toxins, and other foreign bodies as they form physical barriers that prevent entry. COVID-19 is able to penetrate physical barriers when they are vulnerable. Again, if you have a deficiency of these nutrients and the other things that we talked about. The integrity of the physical barriers is important for reducing the risk of COVID infections. Zinc, vitamin C, and D act as in synergy, promoting barrier integrity, and that's incredibly important. At the beginning of an inflammatory response in the lung, the mobilization of zinc to epithelial cells is an essential innate response to both increase immune function and to protect other cells from damage caused by inflammation. Vitamin C and vitamin D work similarly to zinc in promoting barrier integrity. Several minerals and vitamins have antioxidant, immunomodulatory, and antimicrobial roles that could be helpful for the immune response against the SARS-CoV-2 virus. I think that should be on the first news headline every time that we hear the news. It should be the first one, in my opinion. Supplementation of micronutrients emerges as an important measure to improve the immune system and to prevent the development of severe symptoms. These micronutrients include vitamin A, B, C, D, E, and minerals such as selenium, magnesium, and zinc, and omega-3s, as we talked about. The strongest evidence for immune support is zinc, vitamin C, vitamin D, omega-3s, and magnesium now too. Okay? Zinc and vitamin C and D are integral parts of the immune system and show synergistic functions at various stages of host defenses, such as the maintenance of the integrity of biological barriers and the functionality of cells that make up the innate and adaptive systems. The medical literature demonstrates that the supplementation with zinc, vitamin C, and vitamin D can mitigate viral respiratory infections, including SARS-CoV-19. And comments from my friend and colleague, Dr. Dan Murphy. Based on the other studies I've reviewed, I believe that the synergy of zinc and vitamin C and D should also extend to vitamin K2, 4, and K27, magnesium, and omega-3s. If you want to have a stronger immune system, you add in these nutritional cofactors here, these micronutrients to your regimen. I'm Dr. Scott Fuller. Thank you.